COVID-19 has paralyzed this world, especially India, in the second wave. Many of us have lost our beloved ones and we are all distressed. We at Emmrc Chennai, Anna University, we have made this video so that you understand the do's and don'ts of COVID-19. There are various experts from different genres who have spoken about what to do and what not to do once you're diagnosed with COVID-19 or if you've already been infected by this disease.
India is battling a second wave of COVID-19 and currently the second highest number of COVID-19 cases in the world after the USA. The country is working day and night for hospitals, ventilators and medicines. The present scenario of the pandemic in India has been faced by myriad challenges in its fight against COVID-19. The second wave in India has been widely attributed to the variant mutant called B1617, which is responsible for the surge. All sectors from hospitals to institutions are working along with the government to eradicate this pandemic disease. Anna University, the pioneer institution in India, has extended its service in providing COVID Care Centre for Greater Chennai Corporation from first wave to the second wave.
Anna University, being one of the largest technical universities in the country, has been striving very hard to combat the COVID-19 situation that we have been facing for more than a year. To tackle the second wave, we have been extending our support to the government in terms of providing our hostel facilities for establishing the COVID care centers.
All viruses, including SARS-CoV-2, the virus that causes COVID-19, evolve over time. When a virus replicates or makes copies of itself, it sometimes changes a little bit, which is normal for a virus. These changes are called mutations. A virus with one or more new mutations as the variant or the original virus.
Here the problem is about 30 to 40% of patients are not identified. They are the spreaders. Now why is second wave more or worse than the first wave? Maybe a few reasons we can say. One reason is definitely there are mutant genes, mutant viruses, which means that the virus, normally what happens in an infection is that when a person gets infected, they develop immunity, and when the society gets infected, they get a herd immunity, and with herd immunity of 60 to 70%, the infection spread comes down. But now what happens is, though we had the first wave with little bit of infection and herd immunity, we have now mutant genes which are doing completely a different set. So we are having the regular virus plus the mutant virus doing the job.
In the ongoing second wave, there are a few cases in which COVID-19 impacts children's lungs, leading to pneumonia, and the child requiring oxygen or, in most serious cases, a ventilator. They do not require any treatment other than paracetamol and multivitamins. Many children are also asymptomatic and tested only because a family member has COVID-19.
In wave 1, what we had seen was not many younger children, less than 18 years, were involved, and they were not having severe manifestation, though some had. But in the second wave, we are also encountering a lot of pediatric age group people getting affected, and the severity is also a bit more. And what happens is, right across the globe, the reported percentage of children getting involved, that is people less than 18 years getting involved, is anywhere between 3 to 8%. So what happens is, if you say around 5%, for 100 people, if it is 5, for 1,000 it becomes 50. So naturally, when there is an exponential increase in the number of cases which we see in the community, naturally the pediatric population also getting affected will get reflected in the same manner. Children, they manifest slightly differently as compared to the adult. They can predominantly have milder symptoms or no symptoms at all. That's what we call it as an asymptomatic manifestation. They can also have severe manifestation like called the MIS-C. That's a multi-inflammatory systemic manifestation secondary to corona, where any organ in the body can be involved, not leave alone the lungs. It can be the heart which can be predominantly involved, it can be the lungs, it can be the kidney, or it can be the intestine or the tummy, or they can also have fits and abnormal behavior and manifestation.
The COVID-19 vaccines that are currently being approved are expected to provide at least some protection against new virus variants because these vaccines elicit a broad immune response involving a range of antibodies and cells.
So far, the studies have shown that the current vaccines are able to produce neutralization even among the established mutants right now. Even in future, if more mutants are going to come, still, if you are going to have an antiviral antibody response in your system, this will definitely help you fight against the viral infection. And for every new mutant, there would be a little version of natural booster happening. In general, I would say taking a vaccine, especially this anti-COVID vaccines, are the best strategies approved by the government and also one of the best ways by which you can prevent transmission of virus in the community.
Pregnant women or recently pregnant women who are older, overweight, and have pre-existing medical conditions such as hypertension and diabetes seem to have an increased risk of developing severe COVID-19. When pregnant women develop severe disease, they also seem to more often require care of intensive care units than non-pregnant women of reproductive age. Due to changes in their bodies and immune systems, pregnant women can be badly affected by some respiratory infections. It is therefore important that they take precautions to protect themselves against COVID-19 and report a possible symptoms including fever, cough, or difficulty in breathing to their healthcare provider.
In the year 2021, we have been seeing the wave 2 from almost a month now, and the COVID has been not very good to the pregnant women and to the obstetricians of the country. So we've been having a lot of pregnancy complications and COVID in the COVID wave 2. And having said that, when we have a COVID positive patient, do we treat them for COVID or tackle with pregnancy? Fortunately or unfortunately, we'll have to do both because we always deal with mother and the baby. Coming to the investigations which we take, we will do the usual investigations of a COVID patient like anybody else. But here, because of the pregnancy, we may not be able to do the CT scan which is being done, and they report the CT being mild, moderate, severe. We will not be able to do a CT because CT is not very well advocated for pregnant women. There are other blood tests which you can always do, and they will also give us a little bit of clarity on whether the severity of the disease is mild, moderate or severe. So we can go ahead and do. So diagnostic issue is a reasonable hindrance in pregnancy. We'll have to keep that in mind. If a patient contracts COVID at around 36-37 weeks of pregnancy and she's up somewhere near delivery, we would try and push the delivery to another 2 weeks if we could do so. Breastfeeding is safe in COVID positive patients, no doubt about it, because the patient would have developed some antibody and the breast milk would pass on the antibodies to the baby and give protection.
Nearly 10% of people diagnosed with COVID-19 experience prolonged symptoms including troubled breathing, blood clots, headaches, nausea, muscle pain and fatigue that last for weeks, months and possibly years after testing positive. Yoga is helping these long-haul patients in easing stress and pain, maintaining mobility and breathing easier. Even the World Health Organization has urged people to take up yoga during the pandemic.
Yoga helps to boost immunity through two ways. First, it activates your parasympathetic system and reduces all your stress. The lower the stress, the higher is your immunity. The second method by which yoga can help you boost your immunity is by production of immune cells inside your body. So let's quickly get into the practice of yoga and pranayama techniques to increase your immunity as well as to improve your oxygen levels. So the first technique I am going to tell you is about yogic way of breathing. First, we'll see about abdominal breathing. For this, gently place your hands on your abdomen. Close your eyes. Inhale. Exhale. Now moving your hands upwards and we are shifting towards thoracic breathing, which involves your ribs and intercostal muscles. Next, moving on to your third part, which is your collarbone or clavicular breathing. This involves your collarbone as well as your shoulder joint. Mudra involves interlocking or giving pressure to the fingertips. The right way to do this mudra is to interlace your fingers of both your hands. Now, slowly wrap your right index and thumb finger around your left thumb. So, your left thumb should stand out. Now, stretch your shoulders and place it in front of your chest, to be precise, exactly in front of your sternum. Exhale, suck your abdomen in, lean the air out. So the next technique I am going to share with you is Pranayama, which is otherwise called as humming bee breath. To practice this Pranayama, we need to adapt Shanmukhi Mudra. Shanmukhi Mudra involves all your 5 fingers around the branches of your facial nerve on your face. So take your little finger below your mouth, your ring finger above, your middle finger around your nose, your index finger above your eyebrows. Which will increase your lung capacity, relieves you from breathlessness. The next technique I am going to tell you is about pronation, which involves lying down in your prone position. For this, just lie down on your stomach with your hands beside your thighs, your chin on the ground and your legs together. Now slowly take your legs apart. Now take your both hands to the front, interlock your elbows and point your forehead down. Now as you have your heels together, your toes pointing laterally, you can very well feel the stretch along your spine. Point your forehead down. So these are the 4 pranayama techniques that I have taught you. You can incorporate these 4 practices in your everyday life.
Epidemiologists say in most of the countries, the second wave is always much bigger than the first wave. And the reason is that in the second wave, a lot of younger adults are affected.
The question is whether people can have reinfection with COVID. The answer is yes. People have been found to be PCR positive twice, and that has been well documented. How far and how much and how severe they manifest is questionable, and now as of now not many serious manifestation in the second attack has been reported so far.
It is also important that all of us get vaccinated so that we develop the herd immunity and we are able to protect each other.
Vaccines are the critical tool in the battle against COVID-19. And there are clear public health and life-saving benefits. We must not put off getting vaccinated because of our concerns about new variant. And we must proceed with vaccination even if the vaccines may be somewhat less effective against some of the COVID-19 virus variants.
Infection spreads. You need to stop the spread. How do we stop the spread? The stopping the spread will be only 1, wearing a mask, 2, social or physical distance, 3, hand sanitizer, and vaccination. Vaccination is, basically these I will call it as weapons. Now, no weapon is going to give you 100% protection, but you have 3-4 weapons, more likely to be more protected, that's all. So I think you need to look at all the 4 things and follow that very diligently, and this is going to last at least 6 to 8 months. And after that, it will become like any other disease like tuberculosis or cholera or whatever. It will come and go. We'll all handle it. It may not be in such numbers.
Let me just say, in the year 2019, we said avoid negative people. In the year 2020, we said avoid positive people. In the year 2021, avoid people. Please follow social distancing and maintain the norms which has been put forth by the Government of India. Stay safe and stay cool.
India has faced pandemics and situations like this, and we have emerged gracefully from those situations. I am sure and confident that we would also emerge from this situation as soon as we can. I am confident that we would come out from this as well. Let's fight it out. Together we can. Jai Hind.
Though this COVID-19 second wave infection is an enormous global health threat, India is taking necessary preventive measures to reduce viral transmission. Both the state and central governments of India are working hand in hand in eradicating the virus at the earliest. Let us hope things will change soon.